As you go into the marketplace, there are various insurance terms that you will come across. The health insurance industry has its own vocabulary, so it's important to know what these terms mean. A glossary of health coverage and medical terms is being provided to you with definitions as a download. A premium is the amount that must be paid for health insurance. A person and/or employer usually pays it monthly, quarterly, or yearly. A deductible is the amount per year a person owes for health care services before the health insurance begins to pay. Coinsurance is a person's share of the cost of a covered health care service. The insurance company decides how much it will pay for certain health care services, what it thinks it's fair for the service. Coinsurance is calculated as a percent, for example, 20%, of the cost of service permitted by the insurance company. For a covered healthcare service, the person pays the coinsurance plus any amount of the deductible not yet paid. Insurance pays the rest. Copayment is a fixed amount, for example, $15, a person pays for covered health care service, usually when getting the service. This amount can vary by the type of covered health care service. So now it's on to the health insurance marketplace. The health insurance marketplace is an entirely new entity created as a result of the Affordable Care Act. Many health insurance companies sell plans on the marketplace. Insurance coverage through the marketplace is available with financial assistance and without financial assistance. To receive marketplace financial assistance, you must qualify based on income and household size. In order to get started, you would need to go to the marketplace website at www.healthcare.gov and choose the state you live in. Then you could create a profile for yourself with a username and password. Once your profile is created, you can move on and start your application. So what is the marketplace? How many of you ever shopped at Amazon? The marketplace is similar. It's an online shopping venue where instead of buying toilet paper, you can buy health insurance. At www.healthcare.gov, you can see if you qualify for financial assistance and see all your options to help you make your decision. And yes, you can enroll at www.healthcare.gov as well. Many are eligible for the marketplace, but there are some eligibility requirements. These requirements are: you must live in the United States, you must be a U.S. citizen or U.S. national or a lawfully permanent resident, and you cannot be currently incarcerated. If you have more questions about immigration status and eligibility in the marketplace, visit healthcare.gov. You can also download the handout from this course that goes over the various immigration statuses. All healthcare plans on the marketplace must offer these 10 essential benefits: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, and chronic disease management, pediatric services including oral and vision care. Most health plans offered on the marketplace have several levels of coverage. You will need to choose a level of coverage. With health insurance coverage, both the consumer and the health plan share costs. The higher the level of coverage, the higher percentage of the medical costs is paid by the insurance. While the higher the level of coverage, the more expensive it is typically for you. However, it is possible that one insurance company's silver plan could be less expensive than another company's bronze plan. Individual insurance companies are not required to offer all 4 plans. And remember this: cost sharing is only available under the silver level plan. It might be tempting to choose a plan simply because it has the lowest monthly premium, but there are a number of considerations outside the cost you should take into account when selecting a health plan. The list of doctors that can be seen through a specific plan is called the network of providers. If you want to see a specific doctor or specialist, it is important to find out if he or she is in the network of providers for that plan. Call the health plan to make sure your medical provider is part of that plan's network, because the network providers change often. Which plan fits my budget and it still meets my needs? If you use a lot of healthcare, make a lot of visits to doctors and/or specialists, it might not make sense to choose a low monthly premium plan with a high deductible, because you may end up paying a lot upfront until you reach your deductible. Are my medications covered? Every health plan has a list of prescription drugs that are covered called a formulary. There are often several tiers of medications. The lowest tier, which costs the least, is generic, not name brand, drugs. Brand name drugs may also be available on the plan but may cost more, so the person may have to pay more out of pocket. Can I get dental coverage? Dental coverage is available in the marketplace for both adults and children. Dental coverage must be offered by marketplace plans for children, either embedded in the health insurance or as a standalone product. Neither adults nor children are required to purchase dental insurance, i.e., you will not be penalized if you don't have dental coverage. Nonetheless, it makes sense to have dental coverage if you can. There are people to help. There are several types of trained, certified people available locally to answer your questions and assist you with your decision making.